I had some discoloration. One tooth was white, one tooth was kind of yellow. They didn't match.
I have discolorations from medication when I was younger, so I just want a whiter and prettier smile.
I fell in my driveway and cracked 2 of my front teeth, and we had to have some bonding done, and from that standpoint, I had some discoloration in my teeth as well as from the caps.
I was having a lot of pain with a tooth on the bottom.
I am petrified, was petrified of a dentist, and had been since I was about 20 years old.
I was always, very self-conscious about my smile.
All my life I've had trouble with my teeth, and I needed some implants done because I was missing a few teeth.
Holly came to us just like a regular patient would. She looked through the referral sources that she knew about, and she knew a friend of mine that had done a nice reconstruction for himself, and that we had completed. And she came in and said that she wanted to do what Joe did.
What I've been doing over the process of years was doing 2, 3 at a time, and they didn't match. My bite was off, and I just wanted to have everything done at the same time to where the colors would be the same, and I would feel more comfortable when I smiled.
Hey, good morning, Holly. How are you doing this morning?
Good, I'm excited. My problem has been throughout the years is that I have not committed to it. I've just kind of, okay, well here we go. This needs to be done. If you make a decision or a choice to do something, try not to let yourself get worked up about, let's just say, how much something is going to cost or that you're not deserving of it, and just be open to how things work out. Anything's possible if you put your mind to it. If you hope and pray about things, and if it's meant to be, it'll happen. You go to a lot of doctors, you go to a lot of dentists, you go to a lot of places and offices, and it's very seldom do you find from the minute you walk in the door to everybody that you see that they're wonderful and they're nice and they're just real people.
Beautiful. Absolutely nice. Thank you.
And that's what I love about here. I mean, everybody is fabulous and nice, and I feel comfortable, and I feel so lucky to have found this office.
My name's Sharon. I came to Suwanee Dental Care, and I saw Dr. Schwinderman. Dr. Schwinderman looked at my tooth. I was really, really nervous about getting the shot to, so he could work. And I must say that was the first time, and I've been to several dentists, that I've had a shot done that I did not feel it. I did not even feel a pinch. I don't know what he did, but I didn't feel anything. Everyone here is very friendly. I like the part too, when you leave, you get a flower. I just think that's really neat. So, Dr. Schwinderman is, he's a good dentist, and he's put all my fears at ease.
I'd always seemed to kind of half smile. I never fully smiled, even some of my speech. I just noticed it over the years, just kind of in pictures I'd kind of, not smile fully.
He came to us through the dental website, drugal.com, which is a dental referral service, and he told me he was looking for a cosmetic makeover, a smile makeover. Well, he was looking for getting rid of his gaps, getting rid of the uneven colors in his teeth. He had been many years since he had had any major dental work done, and he was just looking for somebody who could do a complete reconstruction.
I've been to a couple different dentists, and I had some discoloration. One tooth was white, one tooth was kind of yellow. They didn't match, and I wanted a smile that looked healthy.
Hey, good morning, Rob. Sit for a big morning.
I've had some anxiety about a dentist because of the way I've been treated in the past with different dentists. So when I started searching around, I knew I wanted to get this done. And even though Dr. Williams is probably 25, 30 miles away from me, I still felt, you know, his credentials and all the technology behind his office, it just made me feel comfortable with him.
This is going to be your best day ever.
Dr. Williams not only treats you as a patient, but he treats you as a friend. So, you know, that he's called me after dental visits. He's made sure that I feel fine, which that type of practice, that's not done with a lot of dentists or doctors. My expectations were exceeded.
The moment of truth.
The moment of truth. Oh, man. Everybody here made me feel very comfortable.
That is so nice.
It's hard to explain, but everybody just made me feel great.
That's wonderful.
You do look like a new man.
Yes.
It's the best dental office I've ever been to in my life, and I've got a couple years behind me.
My name is Clarissa, and I'm a patient of Dr. Jeremy Smith. As his assistant, you know, I know he does good work, and he equally did good work on me. He lets you choose what you want done. He doesn't ever just say, you need this done. He always, you know, gives you every option. You know, it's the best. He always thinks about the person's best interest. He treats them like they're his family.
I'm Catherine Woodruff, and I am a patient of Dr. Hayward. What brought me in was a very, very old crown that was starting to be very noticeable. So I started researching, and, you know, I started asking other people around that had their teeth done, and, you know, I'm asking the people that have beautiful, healthy smiles, and I think 3 out of 5 of them had been to Suwanee Dental. So I said, well, that's probably where I'm going to go. And I came in here for a consultation and just really liked everything about the office.
My name's Joe McKinney. I am a patient of Dr. Williams. I came to Dr. Williams because I'd worn my teeth out. Apparently I grind them at night, and I'd noticed that the height of all the teeth was disappearing. He was very good with me. I'm generally one that's interested in a lot of the details of what takes place. And he was very thorough in discussing what we were going to do, the options I had. And then I was very impressed with his knowledge as well. Not many dentists in this area seem to have the comprehensive knowledge that he does in approaching reconstruction.
Dr. Hayward pays attention to every single detail, and he really, really listens to what the patient wants. And he's very good about explaining all the different options that you have, whether it's from a financial concern or whether it's from a cosmetic enhancement concern. I mean, whatever it is, there are many different choices that you can make, and the fact of the matter is that he is incredibly well educated. They have the top of the line technology here. He cares so much about his patients, and he really wants you to be satisfied and happy with the work that he does. He is a perfectionist, which I absolutely love. You know, he really didn't want to stop until he felt it was absolutely the best that he could do, and that was very important to me. It wasn't just, you know, oh, she'll be fine with this. And no, he really wanted to take the time and make it perfect.